We now go to Harlem, where the Legionnaires' disease outbreak has now claimed a fourth life. This as the number of confirmed cases continues to rise.
Meanwhile, the city has released a list of the cooling towers being tied to this outbreak. Good day's Briella Tomassetti joins us with those details. Briella, what's happening?
Yeah, Dan and Tashani, well, that's at least a major development in this story. The outbreak resulting, though, in nearly 100 cases. Officials say more than a dozen people still in the hospital. And for the first time, like I mentioned, since that outbreak started, city officials finally identifying which buildings are connected to the deadly disease. A dozen cooling towers in 10 Harlem buildings. Well, they've tested positive for Legionnaires. 4 of those buildings, which include Harlem Hospital, are city-owned. 11 out of the 12 cooling towers have been treated, and the final remediation is slated for completion today. The health department says testing is underway to confirm whether there's a link between those who tested positive and the towers that contain the deadly bacteria.
We're requiring cleaning and antibacterial treatment of those 12 towers. What this means is that, yes, these buildings were positive for the kind of bacteria that can cause people to get sick, the Legionella that can cause illness. Per our protocol, the New York City Health Department's investigation on the source responsible for Legionnaire's disease cases in Central Harlem is underway.
The fourth death was reported less than a week after city health officials tried to reassure Harlem residents that the outbreak was under control. They held a town hall discussion last night to provide the community with more information, stressing that the disease is airborne and could reach people outside of the 5 impacted zip codes in central Harlem. Health officials also noted that while most people experience flu-like symptoms, Legionnaires can be treated effectively with antibiotics if caught early enough. Still, some feel like they left that meeting with more questions than answers.
Building that I live in, they have like a air vent in the bathroom, and nobody comes upstairs to clean that out. I have to literally go up there and scrub that myself because remember it gets dusty.
I asked about how do you know you're cured once you are diagnosed with the Legionnaire and you did receive some of your medical attention, then what happens afterwards? So those that don't do hospital follow-ups will know at home what to do and how people at home can take care of that.
And some Harlem residents criticize the city for not previously releasing those locations of the 12 cooling towers that initially screened positive for Legionella bacteria. The acting health commissioner defended the move, saying she didn't want to give people a false sense of security until the investigation was complete. Dana Tashani, back to you.
Briella, thank you so much.